Did you know in the first 5 years of menopause, a woman can lose up to 30% of her body's collagen? This is terrifying. I'm Erin from Blush Aesthetics, and we're going to talk a little bit about menopause and the aging skin of the face. So have you ever woken up in the morning, looked in the mirror and been like, I feel like I may have aged overnight? I know that it feels that way. It doesn't necessarily happen that way, but you start paying attention to certain things and looking a little bit more closely, and you're like, I didn't usually have fine lines and wrinkles there before. I didn't used to have, some of this loss of volume. And so that happens. One of the things that we really focus on at Blush is the anti-aging process. And so in order to do that, you have to take the aging process into consideration, right? So a couple things that we do to combat this are internal, and a couple things that we do to combat this are external. Obviously, nutrition, and that's really up to the patient. Unfortunately, we can't come home with you and follow you around and know what you're eating and making sure that you're wearing sunscreen and things like that, but sunscreen does help, and so does nutrition. The other thing is Sculptra, which is an internal collagen stimulator. So that is something that we rely on a little bit more heavily as we start seeing that aging process happen. After years and years of loss, then you're in more of a facelift situation, but in the beginning, when we're more preventative or when we're first starting to see those signs, it's an amazing tool. The second thing that we utilize a lot for collagen benefits in aging is broadband light. So we know from the Stanford study on broadband light therapy that our Forever Young protocol, which has really kind of, I would say, progressed over the time that we've been doing it. So that Stanford study was a while back. Now we have new protocols that are even better at making sure that we're stimulating collagen on multiple layers of the skin. This was a biopsy proven study. And so we utilize those protocols almost, I would say, regularly for most patients, unless you have melasma. But that's typically not what we're seeing necessarily in that menopausal patient. So we encourage you to add broadband light to your tox appointments. Why? Because we can iron your wrinkles again, and we can make you look younger in that capacity, but you're not going to actually look more youthful unless we're building collagen and we're cleaning off kind of what's on the surface of the skin. So we're dry cleaning you and then we're tailoring you, and we use both of them together very successfully. And then the last thing that we're doing is really curating a specific type of topical protocol. Now, topicals alone are not going to do it because they can't penetrate deeply enough into the skin to actually make the changes that we need to make in order to stimulate that collagen, to repair, to clean out, and to maintain. So if you are of the age that you're dealing with menopausal aging changes of the skin, visit us at blushnwo.com, and we're happy to create a personalized care plan for you.